welcome everyone who's not looking at us right now to the August 16th Board of Health meeting. Our first order of business is to review and sign our meeting minutes from June. Those were all sent out to everyone. Do I have a motion to approve?
I make a motion to approve.
Second. All in favor?
Aye.
Okay, and those, is this the copy to send around for signatures?
Yes, sir.
All right. Thomas, you can do this first and pass it down. Smoking, we can't really,
She's coming upstairs.
okay.
Yeah.
So the smoking regulations, we all went through them and everybody got a copy. So the idea is now that we would vote to approve as they're written, and then we will schedule a public hearing for those in the next month. So do I have a motion to approve?
I make a motion to approve the smoking regulations.
Second. All in favor?
Aye.
Okay, done.
So, my question to the chair is, the next step now is, the board will decide when to have the public hearing, correct?
Right. So, the question is, if we have a public hearing, is anybody gonna show up?
Yes.
You think someone will, other than the health department?
Well, it's encouraged to have a public hearing. I think there's businesses in the town that may have some questions, but I think for transparency, I think we
Oh, no, I agree, I'm just trying to think about timing, so I'm thinking if we have the public hearing prior to our next meeting, we could maybe kill two birds with one stone.
I believe since Chair is here from the city of Worcester, who's the tobacco compliance coordinator. Chair, we are discussing the next step since the board has agreed to,
Okay.
now they want to decide the public hearing process.
Yeah.
If you can talk to that.
So yeah, we would do a legal ad in whatever
Why are you just so organized now? I just
Sorry.
whatever legal newspaper West Boylston publishes their ads in. So we would do that, and then Jessica would send out a letter to all the retailers notifying about the public hearing, and then on the day of hearing, if you it is up to the board to also decide that if they want to also include a virtual link for public hearing, and then people come, and we also notify them of that the board will take written testimony, and there will be a deadline to that as well. And then when on the day of hearing people come, public comments are noted down, and it's up to the board that you can either vote, I think, in the next meeting. I'm not sure if you can, you would vote on the same day. It all depends on how much time goes in the public hearing.
So what we just voted on was the regulations that we're gonna present at the public hearing.
Yes.
And then after the public hearing, we will vote to stay with the the regulations as printed or make changes based on the public hearing, correct?
Based on the public hearing, but also from this body approval.
So,
I have something to, I noted that there is a definition for adult only in this draft. I think this is different than what is in the sales regulation. So we should, I would ask Cheryl about it to have the same definition what we have in the West Boylston Board of Health regulation to maintain consistency.
I thought what we dealt with was what was sent to us.
As far as the draft by Cheryl,
Yes.
that's correct. She did draft that.
So what we have is what was recommended to us, right? With, and we voted on the changes at the last meeting, and now we're voting we voted on this, so.
I will speak with her because it looks like it's a conflict. Both definitions are slightly different. So I would check
Yes.
with her.
I think from, just to clarify some of the
Yeah.
language in there, we just wanna be sure that the language is right. So maybe.
But I thought that's what we were getting, was the
Yeah,
correct
so-
language.
Yes, but Cherry just noticed something now, looking at the documentation again, that the language should be consistent. So, and why Cherry need guidance from,
I'm sorry, Mr. Chairman, I don't know what needs to be consistent. I mean, if we voted on these regulations,
No, it's just one definition.
it's just one definition,
Yeah.
it's a specific
What's the
language.
where?
The adult-only retail tobacco stores.
What page, please?
It's page 3, section C.
Thank you.
Our page 4.
page 4.
Thank you.
That's good.
And what's,
We have to decide which one, the yellow or the green that we choose, the language from the state, or,
So, as far as I remember, the the West Boylston sales regulation that has regulation that restrict tobacco sales, that document has the green definition.
and that's not consistent with the language
That is here.
that is here?
I think it just says
No,
that any.
it's, no, these two are same.
These two
Oh,
are not
no.
the same as yours?
Well, there's one thing different, and that is that
Yes, it
the
says.
green doesn't allow anybody under the age of 21 to work at the establishment, whereas it's not said anything in the yellow one.
Yeah, it also, the green one also says actually that it, that does not sell food, beverages or alcohol and does not have lottery license. So if you remember, there was one retailer who was an adult only and he returned his permit and is now a general retailer because of this definition.
Is that, through the chair, is that the establishment that he can no longer sell the lottery?
Yes.
Yes.
Because I actually went up and met with him, because I was asked by the select board to go up and find out what was going on up there. And frankly, I don't understand, Worcester allows them to sell lottery, right? The tobacco establishments?
Yeah, currently in the regulations, but then their incidentals have to be 10% from lottery sales. The revenue that they generate from lottery and other incidentals has to be 10% in any adult-only retail store, tobacco.
So, for me to understand this, we're prohibiting the lottery sales at our tobacco-only store, whereas Worcester allows that. Is that, do I have that right?
Yes.
Okay, and I gotta tell you, I met with him, and lottery is very important to his sales.
but why do we want to encourage sales?
Of what, the lottery?
No, of tobacco.
Well, well, he's a businessman, and it's a business in town, and that's all.
The goal is, of the Board of Health is to reduce smoking in the world, I think.
I understand that, but it seems a little contradictory or unfair that the city of Worcester, who is our enforcement agency, allows the lottery sales and we don't.
They have strip clubs and we don't either.
Well, we don't have them yet.
Well, Cumberland Farms sells lottery tickets and cigarettes.
Yes, but that's a general
Tobacco
convenience
only.
store. Yeah, it's a different definition.
Okay.
Right. Yeah, I understand. I just want to make his point known because I'm sure that he will attend our public hearing and ask for clarifications.
So I'm confused here. What we voted on was the yellow?
So, red cherry was the yellow one?
I don't think, are you talking about the, what was adopted in the sales reg was the green one?
Jessica, which did you send out to everyone, the smoking regulations?
Was
This exact document, what we voted on were numbers 1 through 16. I don't believe anybody touched interior with Cheryl or Cherry.
So this is not the document I'm talking about. I'm talking about the West Boylston tobacco sales regulation.
Oh, this is.
I'm only,
Well,
I
this is
want.
secondhand smoke.
Yes,
Okay,
and
so-
this is smoking regulation, so I just want to clarify with Cheryl Sabara that this definition should be it should be consistent with what is in the other document. Because then it's conflicting.
Gotcha.
What are you going to enforce on, right? So,
Okay, so we need to vote on section C, definitions. Do we want the yellow or the green? Is that correct?
yes.
Yes.
Okay, I got it now.
I'm glad you do.
Yes, so
We're voting on this or this?
Okay.
You want A or B?
So it's not, it's like an amendment saying that since, in my understanding, since the sales regulation has the green definition, so we would amend it to be,
To
to
be like,
this one to be
according, to
included in the
respond to what
smoking.
we already have in place.
Correct, yeah.
All right, can I have a motion to that effect?
Motion to adopt the same language as the smoking sales
Okay.
document.
I second it.
All in favor?
Aye.
Aye. Okay. Done. All right, now, the question is, when we have the public hearing, what is the appropriate time to have that? Is that in the evening? Is that
Yes,
when you want to do that? Yes,
yes.
okay. So maybe, maybe a good idea, rather than increasing the time commitment of folks, that we could have a meeting in which we use our usual timeline where we're finished in a half an hour, and we have the public hearing, say, at 6:30 on the night of the meeting. If people are in agreement with that?
Fine with me.
Okay,
I'll
so,
motion that the public hearing be held concomitant with our next meeting.
good.
Concurrent. Would that be September 13th, the second Wednesday?
Well, whenever we, we'll shoot for that as our date, and we have to have this advertised in a
2 weeks?
paper, right?
Yes, so
And
you
what's the
would-
time frame on that? Should it be a week before or 2 weeks before?
So what currently in Worcester, we are following that the first publishing should be done 14 days before the
Okay.
hearing.
So let's plan on the second Wednesday of September, and 2 weeks before we'll publish the ad.
So does that mean that, like with Labor Day on the 4th, that it needs to go like on the 28th of, do you have to account for a holiday or whatever?
No, but then you would have to publish it in that same week, 14 days before. But then I'm not sure if that is enough timeline to ask Cheryl to proofread the legal ads.
So I think, Chair, you think they can move the public hearing to October, give us time, this committee
Yeah.
time to review all the documents, then we can do it in October?
That's fine. I
Okay,
think I can make the September meeting anyway.
yeah, that's fine. Okay,
The second Wednesday would be the 11th, that's
11th of October.
the week of Columbus Day, or we can push it back to the 18th, which does not include a holiday.
I won't be here on the 18th.
Okay, October 11th.
Wait a minute. I will be here on the 18th. I won't be here on the 11th, so,
Okay, October 18th.
yeah, okay.
Okay,
Will you be here, Tom?
I think I will be, yes.
Okay.
So we'll shoot for October 18th. Obviously, that gives us plenty of time to make a change if necessary. All right, anything else we need to do about that?
That's it.
That's it.
So it's in person only, right? No virtual option available?
Yeah, I would say in person.
Okay.
Okay.
And I think the small room downstairs will work fine.
If we can get it.
Well, we could, oh yeah, that's out of sequence, so we might be up here. All right, so is that issue, is everyone okay with that issue now? Any other questions or comments? Hearing none, then we'll move to the third item on our agenda. And since our last meeting, I had a great meeting with the town administrator and with Solo and his team from the Worcester, the Central Mass Regional Public Health. And we're now going to get an update. And Solo, do you want to lead that and introduce your team?
Thank you, Mr. Chair. With me this evening is my colleague, Ms. Amelia, Chief of Public Health Nursing,
Okay,
and my colleague, Ms. Karina Scott, who is the Shared Service Coordinator for the Alliance Community. I will ask Amelia to give an update on what we discussed regarding the nursing work, and I will ask my colleague, Ms. Scott, to give an update on the new position and how the position will work with the Alliance town moving forward. And I will be last to give an update on the inspection of work that that is ongoing in the town of West Boylston, if that's possible.
Amelia?
So, hello. So for the nursing
Can you-
work,
Yeah,
is
that's
this
good.
on? Green is
At
go.
least one of us here is deaf, and
Does this help? Can you hear me? Okay. For the nursing work, there is myself and my regional public health nurse, Melissa. We are the two nurses that will be covering the West Boylston communicable disease cases, which includes TB. She's the regional nurse, so she covers the towns, and I cover her, so we help each other. If there's an issue, if there's an outbreak, or we need to rope you into anything, we will send you an email and also to the town administration. We will be reaching out to the senior center and set up a health fair for the fall to include all of the community partners and maybe set up some outreach. We will be scheduling presentations from the DA's office for medication review as well as opioid updates. Usually we do that in the senior centers and the public are welcome. I mean, we can do it in schools as well. We can meet with the schools if that's something that they need. So that's the actual public health nursing piece, we will be looking into if blood pressure screenings are needed at the senior center as well, and if flu clinics are needed for children in the schools in the fall, because I will have access to flu vaccine for children. Okay? And basically anything else that comes up that would require nursing intervention or help or, presentation or outreach, we're open to ideas as well. Okay?
Thank you. Any questions or comments from the board?
For the flu vaccine, would it be the new triple one or just primarily just solo flu?
Just solo flu for the kids, yeah. There's usually 2 that the state has available, and I can order it, the individual shots or the multi-dose vials, so. That's really it for nursing for now, that is.
Thank you, Amelia. Karina?
Hi, everyone. So as the shared service coordinator, my position is really to be the point person between our state grant and our local office as well. I also help coordinate some of the events that Amelia will be putting on, continuing communications with Jessica, making sure our inspectors are out doing everything that they need to do, ensuring that we're keeping appropriate logs. I'm really just more than just a point person. I also work on the community health assessment plan that is currently going on that covers West Boylston. Eventually, once that's done, presenting you guys with the report. Eventually, when we're creating the community health improvement plan, ensuring that West Boylston is on that plan as well. I think that covers most of it. And I'm also just here to really help with any of the things that come up in the board that I can assist with, either researching. I will be having an intern with me as well, so if there's an issue going on in town that we need to think about something, whether it's a nuisance that's going on that is new, we can look at what other towns are doing, present those things, and you guys can make a decision on those.
Sounds good. Thank you.
Also, if I can just jump in one more time, another thing we're doing in Worcester and which we started doing, sending out monthly topic of the month, health topic of the month flyers to the towns and the senior centers for posting. So there's the flyer version and then there's the social media post version as well. And it's based on inquiries that I receive. I try to keep it seasonal, but based on questions that I receive from the public. So our topics don't necessarily match the national topics, okay? It's what's going on inside people's heads at the moment. And currently, this month we have mosquitoes, right? Last month was ticks. So, and next month will be flu-related. Yes.
Is it in more than one language, like for non-English speaking people?
We can do that.
We can do that.
Yeah, we just need to
Yeah.
know what languages, would be the preference, and we can get those done.
I mean, we can do English, Spanish, and something else if needed. Or we can do more than something else.
Yeah, no, I don't, Bob, do you know?
Well, I was just gonna ask about the community assessment. I know I got one on in the email. How else is that spread out in our community to do that assessment? How are you reaching out to the townspeople so they can answer those questions?
So it's currently on the website. I think it was on the website as of Monday, a couple days ago. So anyone that is on the city website, town website, can access the form in various languages. and complete the survey. We've also contacted several of the leaders here in town, and they're actually going to be interviewed for part of the assessment as well, which is the qualitative part of the data. So.
There's a time frame on this. What was the time?
It was the 18th, which is Friday, but it's actually going to be extended until the 25th, as well.
So it was really short time frame that we
Yeah.
found out about it. And
Yeah.
so Jennifer, the town administrator, put it on the town website. And, I think what we can do is, try to disseminate it as much as we can individually.
Yeah.
We do bring it to events. We bring everything we generate to events, health fairs, everything.
I know that they used to bring it to the town concert that they have. They used to have, they've been postponed a lot because of the weather, but the town has a concert on Sunday evenings on the common. And I know that it was distributed there, and now I don't know if it's still happening, but the town had a movie night where the families would go watch a movie at a town location, which is generally put on the website as well. So there are community events that if you want to reach out to have more people participate, I imagine the more people you have participate, the better information you get, right?
That's correct. Currently, when I left the office, we had 709 responses. About 12% of those who responded lived in West Boylston, and 4% worked in West Boylston. So, I mean, I know that it was a short time frame, but so far, it's been a good response. I hope we extend it another week, and we can get a lot more. So I'm actually quite pleased with the results, but I want more, obviously. My goal is more, but we're doing good. So I appreciate whoever completed the survey and so forth. It's been really helpful.
Yeah, all the board members should complete it.
There we
I think.
go.
And we can drop off stacks of them wherever.
Movie night is this Friday. I just looked because I had seen something about that.
And where is it exactly?
It's, I think, let's see, it says it's on the town common, West Boylston, right by the gazebo.
Right.
Okay.
And it says it's at, just after dusk at around 8 o'clock.
Right in the center of town.
Right.
Would there be an area to have a stack of papers for people to look at? Or is that like not something that they would even consider if they're going to a movie? Is it worth the effort to,
I don't know.
you
Well, if
know?
you fill it out, is there like a Dropbox here at the,
No, you'd fill it
They
out
scan
online.
oh, it's a scan.
It's an
You
Yeah,
can
it's a
scan it.
scan.
So
Oh, I thought it was
we could try to make it accessible by having someone just scan it on their phones or click a link on their computer if you received it via email. We do have it in paper, and someone can fill it out, and then we would manually enter the data, which is fine. We've had about 50 of those. I mean, it's much more easier. It's easier
I
for
think
those
it's
to
easy
complete
if
it.
you give, people see this, they can scan it
Yeah.
or,
What about, could we have it a commercial, and then, or make it into like quarter sheet, and, everybody
Pass it
just
out.
gets one as they get there, and then they just bring it home with them?
Do they get movie tickets to,
It's free.
there's nothing that's handed to them?
I haven't been.
Okay.
I haven't been either, so.
Because I was thinking if something's handed to them, then that can be handed as well.
well, they have seats there, obviously, right? You don't
It's
sit.
outside, you bring a
No, do they-
blanket, I think, or.
Oh, okay. One of us could run around and
Doors.
We could, if we had a pile.
Do
Is
we know
there
who
food?
organizes the movie night, as in what department or?
Well,
'Cause I
I
could
know
contact them.
I know one of the people who is, I recognized one of the names, so I could see about. And one of our select people, Patrick Crowley, is also involved.
Oh, good. Well,
Because it could be a simple
Well,
announcement before the
I'll
movie
suggest,
starts, that this is
Jen,
going
that-
around, if
that
anyone wants to
he-
complete it,
Sure.
and what's the purpose of it. I think when you put the the reason why, I think that's what will motivate folks to complete it.
Sure.
The town administrator, I'm sure, would help us. So maybe you could ask Jennifer if she knows that one of the select board members is going to be there, that they could at least pass these out to folks.
Sure.
We have plenty of copies, I think, right?
Yes, yes, we do.
Perfect. Okay, thank you.
Thank you.
Solo, do you want to say a few things about our inspectors?
Yes, thank you, Mr. Chair. So, as of today, I've been working closely with Jennifer. Jennifer, thank you so much. We have, the process we developed since that position has been vacant is I check in with Jennifer every morning.
Please talk into your microphone.
My apology. I said the process is. Jessica?
Yeah.
Sorry, Jessica. My apology. Jessica. I check in with Jessica every Monday morning. She sent me complaints, inspection that need to be done. I share those inspection requests with the inspectional services inspector that have been assigned to me to assist the Alliance community. And that whole process has been going very smoothly. Well, as of today, all requests has been made, all inspection has been done, and the follow-up so far has been great in terms of my communication with Jessica, and the whole process in terms of whenever she need guidance from us, from the city of Worcester, in terms of compliance follow-up, but also making sure that the regulations is understood on her end as well.
So what I was asking was that currently you're contracting out the inspector services, correct?
Currently, the city of Worcester Inspectional Services is doing the inspection for the Alliance. Yes.
But you are in the process of hiring.
Yes, so as of today, we have conducted a first and second round interview. We have selected 2 candidates that will be hired pretty soon. And so the next step is making an offer to those candidates, and hopefully they accept. And I'm currently working on an onboarding plan to onboard them in terms of the towns, their roles and responsibilities. So to your question, yes, we have 2 applicants that will be starting as soon as possible, once they accept the position.
And once those positions are filled, we will become familiar with those inspectors.
Yes,
correct?
yes, correct. Thank you.
Okay,
Yeah.
perfect. That's what I was looking for. Any other questions or comments from the board?
Just, is Phil still doing our septic?
Yes, yes. Phil and I speak every other 2 weeks, so Phil is still conducting his work.
Okay, agenda item 5. Tracy had asked that we think about having a vaccine clinic similar to what we ran in the early phases of COVID when vaccines were available. And my feeling on this is that the new vaccine, which includes the variant XBB 1.5, so as you all know, these mutations occur and you get different family of viruses. And XBB was the one that basically replaced everything, and it's the son or daughter of Omicron. And currently, the new variant, which some people have called Eris, is actually EG 1.0 or 1.5, and but those are sons and daughters of XBB. So XBB is the variant that will be included in the new vaccine, which will be released, I think, at the end of September or beginning of October. So I think the goal would be to wait until that's released, and then I think there's hope at the nursing level that The state is going to give free vaccine for children, and potentially for seniors. We have to wait and see, but my guess would be, and I think the one thing I would say is that those of us who have received the full course of vaccines are really protected against these sons and daughters of Omicron. It's a question of just upgrading the protection. And so this will be like getting your annual flu shot based on the specific flu variant that's circulating. So the idea would be that we would encourage those at highest risk, which even if you're fully immunized, it is people in the senior age groups. So if we were going to run a clinic, it would, I think, be best to do it at the senior center and offer that for seniors.
That's, senior centers is normally where we have our large clinics. It's usually the best and most comfortable place.
We have a lovely senior
We
center.
do.
Yeah, and if, for some reason, we can't access the adult, we can at least access 18 and under, so. But, like you say, we have to wait and see.
Mr. Chairman, am I gonna have to have a COVID shot, a flu shot? Or are they gonna combine those shots?
Yes. But
Eventually.
it won't happen this year. It's going to probably take 2 more years
Yeah.
before they're combined, and they'll throw in respiratory syncytial virus as well. So you'll get flu, COVID, and RSV. The beauty about the mRNAs is that you can add a lot of different antigens, a lot of different viruses in one vaccine. So it really is a significant advance in the technologies.
And
So I'm gonna have to get at
hopefully-
least 2 shots then,
This year you will, yes.
yeah, okay.
Maybe 3 if you get the RSV too.
Because the RSV
Shots,
is,
but 2 lollipops.
I'll give you 3 stickers.
Oh, stickers.
Well, yeah, hopefully, when they do the combination, that it's available to us, because that would be very important for our communities, I think, to offer that. So,
Okay, community health survey. I think we just beat that dead horse, right?
Yes, we did. Unless there's other questions.
New business.
Okay, there's one thing, you skipped over FEP.
Oh, I did, yes. How could I do that?
What a tragedy it was, because they changed the method to sign in for the FEP meeting. So I got up to sign in onto Zoom, and lo and behold, they had this thing called Microsoft Teams.
Yes,
oh,
yes.
I had no idea. I tried to sign into Microsoft Teams.
Yep.
I mean, that's terrible. I couldn't sign in.
a lot of people have issues with Teams.
Yes.
Right. So I looked at the agenda, it was more administrative than anything. So I'll await the next meeting and see what they're gonna do, but
Yeah.
it was disappointing.
You wanna give an update on the trailer park?
So maybe that's why I skipped over it.
That's right.
He knew.
You do, right. You had an inkling.
Okay.
New business.
So, each fiscal year, the board votes on who will be the designated signer for the bill approval. So in previous years, you guys have all voted to choose one person. There is a sheet in your folder, Mr. Chairman, that has the opportunity to sign for everybody, so everybody has to be a bill approval. Or you can choose to vote for one person as the bill approval for signatures moving forward for fiscal year.
I vote for John.
I second that.
Well,
I make a motion to vote for John.
That's good.
that's, I don't mind doing that. Obviously, it's easy because I'm meeting with Jess usually once a week.
Yeah.
So it's very easy just to sign these. So if everybody is comfortable with that, I'm happy to do it.
Well, he seconded it,
Yep.
so, aye.
All in favor?
Aye.
Opposed? Motion carried. Okay.
I have another vote that should take place regarding who will be the designated speaker on behalf of the Board of Health, if it's required for the board to speak at another meeting throughout town or asked.
I make a motion that it's the chairperson.
Yeah,
Seconded.
yeah.
Great.
All in favor?
Aye.
Motion is carried. Okay. Office business.
Sure. So Title V projects, 114 Lee Street has received their certificate of compliance. 23 Shady Lane, 205 Fairbanks Street, and 6 Lancaster Meadows have passed their Title V inspections. On a different note, Casella Waste Management was in violation for dumpster pickup times and had been issued a letter by our previous environmental health specialist, Micah Blondeau, who has since resigned. At this time, the letter has been rescinded and Casella Waste Management will be continued to be closely monitored. Wachusett Estates has passed their semi-public pool inspection and a permit has been issued. That took a few extra months. There has been a total of 137 permits issued to date. There has been no additional tobacco violations reported at this time. West Boylston's 2022 drinking water quality report is now available and can be viewed at www.westboylstonwater.org. And there is a new Massachusetts Community Health Survey that has been posted to our website. That can be found at westboylston-ma.gov under Government and Departments Board of Health. I have 2 bill approvals, one for the Worcester IMA, including the nursing services for July and August 2023, and our previous Sutton nursing services, which was the last pay period of fiscal year. And those are also in your folder.
Thank you.
You're welcome.
Questions or comments for Jessica?
Great job, Jess. Thank
Looks like-
you.
Thank you.
Looks everything's up to date.
Yes.
Thank you.
Any other comments from board members or Worcester Health Department?
Thank you all for coming.
Yes.
Thank you.
Excellent presentations. We appreciate it.
Thank you.
Sometimes it takes us a little time to get on board with what you're saying. I'm sorry.
A motion to adjourn?
Next meeting date,
We, September,
September,
you're gonna send out the second week of
13th.
September.
You
We'll
want
do the-
13th?
September 13th.
And do a poll, Jessica, as we did the last time, and just see that everyone is in attend, okay? We have a motion to adjourn. I need a second.
Motion.
You want us
Right.
back?
All in favor? Thank you all.